What's going on, guys? Tony Maritato here, licensed physical therapist. And if your physical therapist has prescribed wand exercises, I prefer to use a cane, but you can certainly use a broomstick or dowel rod or anything you have around the house. But basically, the main wand exercises you're going to be doing, typically, it's going to involve overhead flexion and external rotation. So when I advise my clients to do these exercises, I usually have them do it with their back up against the wall. Now, you can't tell, but I'm sitting in this position. My back's against the wall. I can feel my shoulder blades. I can feel my sacrum. I could do it standing against the wall as well. And so what I'm going to do is I've got my cane. I'm going to grab the base, assuming my left shoulder is the one that I want to mobilize. This is referred to as active assisted range of motion. And the reason why is because I'm actively lifting the arm, but at this stage in rehab, I'm incapable of fully lifting the arm of my own volition. So I'm going to put the cane in the hand and use my non-surgical or non-involved arm to finish the motion. So it's active, and then I assist the rest of the way. Now, something you can do at this point, after you've stretched the shoulder, is you can remove, sorry guys, you can remove the assistance and allow the arm down in an eccentric flexion. So in other words, I use the assistance to get the arm up. I hold the position for 3 to 5 seconds. I remove the assistance, and I use the musculature to control the descent of the arm. Oftentimes, coming back down is just as difficult as going up. But when you're strengthening new positions that you're not used to, what we call an eccentric muscle contraction or control is really effective. The more you do that, typically then the improvement you get in the concentric motion. The other direction is external rotation. So what I typically do here is my elbow is against the wall. Again, my shoulder blades are against the wall. I'm reaching back into an external rotation with abduction. I can remove the assistance and control the descent. I use the wand or the cane or the broomstick to get me back there. I remove the assistance and I control it. If I don't have the mobility, if you guys saw my last video, I talked about this position as a self-assessment. If I don't have the mobility to get here, what I can do is I can kind of quarter turn. So now I'm not flat against the wall. I'm about 45 degrees from the wall. I'm in the same position, but then from here, this is usually a lot more comfortable than if I was flat back against the wall. And then of course, if I can't get it at 45 degrees, I can go completely perpendicular to the wall. This motion here, again, is a lot more comfortable. I can be in this position working through my flexion. Flexion here is a really interesting motion because it keeps the elbow in. A lot of times when I'm evaluating a brand new patient with shoulder pain, if I ask them to raise their arm, their elbow flares out as they go up. This position with a vertical forearm in front of the body is a challenging position for many patients. If I do this with my side against the wall keeps the elbow in as I go up and back down. Again, if I'm unable to do it myself without assistance, I can use my cane to get me into that overhead position. I can bring it back down. There's a lot of opportunity here, but talk to your physical therapist. Use these videos as a reference. Do not use these videos as advice. They're simply for educational purposes. And if you guys have specific questions, post them in the comments below. I'll catch you on the next video.